Today we will talk about a deformity of breast which is very common. In fact, around 30% of our female patients who come to me for breast augmentation will have either this deformity or maybe a component of that, and they do not know. And this deformity is called as tuberous breast deformity. A normal breast has a shape like this. This is a small normal breast. And if they want augmentation, we can do an augmentation by implants or fat transfer. But what is a tuberous breast? In tuberous breast, the breast shape is like this. If you can see between these two images, the inferior pole is not developed. It is smaller. In a normal breast, it flows like this. And this is what leads to tuberous breast deformity. In these patients, sometimes the nipple and areola size is also bigger. So these patients needs a different procedure than a standard breast augmentation by implants. In these patients, we will have to expand the inferior pole. So how do we do that? Importance is to identify this deformity, because we just don't want a bigger breast in such cases. We also want a bigger breast with a better shape. If we do not improve the shape, the result does not look good. So, how do we correct this? Let's learn. In these cases, we need to expand this pole. So, there is a technique called as radial scoring. So what this technique does is it opens up the bands, the constricting bands restricting the growth of inferior pole of the breast. This opens up. Now, once this has opened up, this has the tendency to contract back again. And that's why what we need is an implant to improve the shape of this breast. And once we have done a radial scoring, the skin can expand. So to keep it expanded, we need to put in an implant. So what we have learned till now, for tuberous breast correction, we need to do a radial scoring technique followed by implant. Along with that, many times in these patients, there is a wide intermammary gap. Now what is wide intermammary gap? If this is this gap is too much. So in such cases, we don't have to just put an implant, we also put fat here to do hybrid breast augmentation technique, so that we get a narrower cleavage, a much better shape of the breast. So what we have learned till now: 1, we do radial scoring. 2nd, we do need to use implant. 3rd, we may need to use fat. These 3 things will be needed to correct the tuberous breast shape. 4th, very important, the size of your areola. If in such women the size of areola is big, then we may need to reduce this size as well. So, radial scoring, implant, fat, and 4th is areola reduction. All these 4 components are important to correct the shape of tuberous breast. So, if you have understood now, correction of tuberous breast is much beyond a normal breast implant or augmentation. It's much more complex, much more detailed, and these details are what makes the result stand out. If you have any questions about this procedure or any other aesthetic procedure, please connect with us. Me and my team are always there to guide you honestly and scientifically. Thank you.